Kenyans. So along that line, we will also do the legislative work and commodities in this country. And secondly,
they are signing the commitment. Let's appreciate them, ladies and gentlemen.
African Leaders Alliance, Uhuru Kenyatta, CGH, President of the Republic of Kenya and the Commander-in-Chief of the Defense. Our request, His Excellency the President.
Primary health care, so that we can change the behavior. Health workers are a very critical pillar in the UHC agenda. It's possible to make sure that there's a facilitative environment for health facilities for themselves. So, Your Excellency, sir, it is important to note that we finally standardized now to really take advantage of the economies of scale to propensity under your leadership that will go.
In line with the clarion call of leaving no one behind, the government will provide health insurance cover to initially 1 million households who are vulnerable and unable to meet even that low-cost premium of $6,000. The identification of these 1 million households by the Ministry of Health, Ministry of Labor and Social Protection, as well as our county governments, is set to begin in a few days across the entire country. Fifth, the biometric registration of the identified poor households, which we launched today, is set to ensure that beneficiaries are identified when they seek services at the healthcare facility and at NHIF branches countrywide, and an e-claim system will be used to improve efficiency and to curb fraud and abuse, challenges which we must address as we scale up. Past initiatives to improve healthcare service delivery have not been a success because of these challenges. Ladies and gentlemen, delivering UHC requires close collaboration and synergy within government, both tiers of government. It will also require greater cooperation with the private sector, our development partners, participation of the religious sector, civil society, healthcare practitioners, and support from the people of Kenya at the individual, family, community, and national levels. I want to make it clear, the scheme we are launching today must be a success. In this context, I urge the NHIF to ensure that the precious funds committed to its custody by both subscribers and supporters are utilized prudently with utmost transparency and accountability. Any person who attempts to defraud the NHIF or abuse its processes will be dealt with accordingly as provided for under our laws. I want to urge, especially our members of parliament, don't delay us by unnecessary debates. We all know where we want to go. What we want now is to begin delivering. We want to begin delivering. Our people deserve it and they want it. And we are asking you to partner with us. This is not the time to show prowess in debate. This is the time to deliver so that our people can get this benefit that we all know has turned many, many households in our country into total destitution because of having to cover their medical bills. We have an opportunity now to fix that once and for all. And I am really calling upon each and every one of you to be active partners in this endeavor so that we can achieve this objective for and on behalf of our people. And those charged with the responsibility of looking after these funds, I want to promise you that if you do not handle these funds with the care and caution that it requires, some of us will go to very extreme lengths to ensure that you shall regret it for the rest of your lives. Let us be clear that we can no longer afford gameplay in this sector. The first is what we are here to witness today, which is to scale up the reforms at NHIF, which shall be comprehensive and fully implemented to ensure that the country has a national social health insurer that is able to responsively meet the needs of Kenyans by strategically purchasing services for their health and well-being. So in this regard, today, I direct the Ministry of Health and the Attorney General to fast-track the necessary legislation that will codify these reforms into law and foster the sustainability of the fund. Indeed, as has been identified in the Building Bridges initiative, Kenyans are eager for improvement in healthcare delivery by both government and private providers. The BBI implementation report proposes fundamental and innovative solutions to the health quagmire that Kenya has faced since the beginning of our nationhood. As a government, leaders and partners in delivering the Kenyan dream, we are called upon to do all that is required of us so that Kenya can indeed be that healthy nation that we seek. The Kenya we want is one in which no Kenyan should leave the country so as to receive the medical care they require. A Kenya that is a world-renowned medical tourism destination, a Kenya whose healthcare bills no longer destroy in a single swoop wealth that has taken decades to create, and a Kenya where every person, regardless of their financial status, will receive the care they need at an institution within the local area, and a Kenya where UHC has become a platform for innovation in developing locally manufactured medicines and equipment. I want to thank, through you, Chair, the county governments. I want to thank our development partners. I want to thank the Ministry of Health, and indeed all other ministry departments and agencies involved in this noble national task for delivering this initiative on time and indeed under budget. In order to secure sustainability of financing for health, I want to urge both levels of government, as has been stated by Governor Oparanya, to ring-fence health sector funds to support the attainment of universal health coverage. I invite all Kenyans and all persons resident in Kenya to register for NHIF and to ensure that they remain up to date with their subscriptions. This will ensure that the fund has the necessary financial depth required to deliver on its very important mandate, in addition to ensuring that in the event of a medical emergency, the fund is able to step in and cover the paid-up member or their beneficiaries. The second is to establish a mandatory UHC scheme which will be managed by NHIF and regulated by the Ministry of Health. And it will act as a national scheme for all persons resident in Kenya, notwithstanding one's social status. 3, adopt the Essential Health Benefits Package, which is already completed and which will enable Kenyans gain access to an essential set of health services at a much lower cost. The package covers several areas, including outpatient and inpatient services, communicable and non-communicable disease management, maternity, dialysis, radiology, minor and major surgery, substance abuse, rehabilitation, emergency services, and cancer treatment, as well as ensuring that we take care of the mental health of our people. These, among others, and we want this provided at the low cost of Kenya shillings 6,000 per household per annum.
The use of biometric technology in healthcare will ensure that we authenticate patient identity prior to treatment, and through this simple act alone, we will drastically reduce fraud in health insurance, reduce the cost in maintenance, and importantly, improve the management of treatment. As we advance into digitization of our health sector, it will also prove invaluable in cases where we have patients in remote regions requiring treatment. They can simply upload their latest record instantly, enabling doctors elsewhere to examine them at their location. And with this improved efficiency, we can channel the cost of savings to even more Kenyans who were previously uninsured or underinsured.
Keep the conversation going. Now we have a convenient way to buy Airtel airtime using Safaricom number through M-Pesa, as following the steps. 1. Go to your M-Pesa menu. 2. Select Lipa na M-Pesa option. 3. Select Paybill option and enter 1562215 as paybill number. 4. Enter account name as your phone number. And lastly, enter the amount you desire to recharge. Then your M-Pesa PIN and hit OK. With those few steps, you're good to go. Enjoy free transaction of up to 100 shillings.